This is Olivia Levin, and I'm doing my newborn assessment. So first I placed the baby in an ambient radiant warmer so that they're not going to get cold during the assessment. I've done my hand hygiene and I'm putting my gloves on. And now I'm just going to look at the appearance of the baby. I'm looking for flexion in the elbows, hips, and knees. I'm gonna look at the symmetry and the body proportions. I'm gonna take a look for any gross abnormalities and just look at the overall appearance. I'm looking for jaundice. I'm looking at lanugo, cyanosis, mottling. I'm trying to see if I can see blood vessels through the skin, any kind of peeling or birthmarks. All right, so now that I've done that, I'm going to listen to the heart at the point of maximal impulse, and I'm gonna listen for 1 full minute and count the apical pulse for 1 full minute. All right, 1 minute has passed. Now I'm gonna look at the breathing of the baby. I'm looking to see that they are having belly breathing, which is normal. I'm looking for any retractions. I'm gonna count their respiratory rate for 1 full minute. This is especially important because babies have periods of apnea that are normal for up to 15 seconds. All right, now that I've counted the respirations for 1 full minute, I'm gonna listen to the lungs. And I'm gonna compare both of the sides. Okay, we're gonna listen on the sides under the baby's arms. All right, we're listening for any adventitious breath sounds. We're making sure that the respirations are equal on both sides. Everything sounds good. Okay, now we are going to check for nasal patency. And by doing that, I'm going to occlude each of the nostrils and make sure that the baby is still breathing. Okay, that sounds good. We've listened. Now we're gonna go ahead and auscultate the bowel sounds in all 4 quadrants. We're gonna listen for 30 seconds for each quadrant. Time has passed. Listen into those bowel sounds. Now I'm going to check the skin turgor by pinching and seeing that it goes back. I'm going to check for jaundice by blanching the skin over the bony prominences. All right, now we're going to go ahead and do some measurements. We're going to take baby's hat off and we're going to measure the baby's head 3 times. To make sure that, we're going to measure the baby's head 3 times to make sure that the measurement is accurate. So that was 1. We're going to pretend like I did that 2 more times. Okay, now we're going to measure the chest circumference. So we're going to do this around the chest. Okay, I'm making note of my measurement. And now we're gonna measure the baby from head to heel to toe. And we're going, or head to heel. And we're gonna straighten the baby out to get that measurement. I can't really do it with this baby because it's very hard. Okay, so now that I have my measurements, I'm gonna lift the baby's head up and I'm going to palpate the fontanelle. We've got the anterior fontanelle and the posterior fontanelle. We're gonna palpate the sutures. All right, I'm gonna look at the head shape and I'm looking for molding, caput, or cephalohematoma. All right, we're gonna assess facial symmetry. This is best to do when the baby is crying so that we can see that everything is equal. All right, it looks good. Now we're gonna look at the baby's eyes. Perla is present. We're going to go from the outer canthus of the eye to the ear to check to make sure that the ear placement is correct. The ear placement shouldn't be low. Looks good. All right, we're gonna look at the ears. The pinna is well formed. They look even on both sides. We can kind of manipulate them to see how well they pinch back. All right. Now we can go ahead and clap to test for hearing acuity, and the baby should turn and kind of be startled by the noise. All right, we're gonna look for nasal symmetry. I guess I can go ahead and put the hat back on, even though baby is in a warmer. The nares look symmetrical. We've already checked for patency. Now we're gonna check the rooting reflex by stroking the baby on the cheek, and the baby should turn their head and begin to suck on the finger. Now while I have my finger in the mouth, I'm going to evaluate the sucking reflex. I'm gonna palpate the gum line and the hard on the soft palate. All right, I'm gonna look at the lips and the mucous membranes. They look moist and pink. Now, if the baby were crying, I would use my light and I would look into the mouth and I would just visualize the palate, look at the gums, make sure that the uvula is midline. Now I'm going to assess the neck. And I'm gonna palpate to see if there's any masses or swollen lymph nodes. I'm gonna turn the head to check. Oh, that's really hard to turn. Just look back and forth to check range of motion. I'm gonna feel the clavicles to make sure that there were no breaks during the birthing process. Okay, I'm gonna get my measure back out, and I'm going to measure the breast bud development. All right, I'm gonna make a note of that. Now I'm just gonna visualize the abdomen. It looks rounded, which is expected. I'm gonna look at the umbilicus, making sure that it's not green. I'm going to check to make sure that it has 2 arteries and 1 vein. And then I'm gonna palpate the abdomen in all 4 quadrants. Just making sure there are no masses or anything going on there. Okay, now I'm gonna check the brachial pulses. Yep. And the femoral pulses. All right, now if this were a boy, I would be looking at the urinary meatus. I'd be checking the scrotum for rugae. I would palpate the testes, and then the cremasteric reflex, which is when you move like that and the testicle kind of sucks back up into the body. Since this is a baby girl, we're gonna look at the labia and make sure that it covers the clitoris, and then we can spread the labia to visualize the urethra and the vagina. All right, we're gonna lift our baby up a little bit and we're gonna look at the anus. You can stroke the skin right there to stimulate the anal reflex, but anal patency will really be proven when the baby has their first bowel movement. All right, now we're gonna assess the hips. We're gonna make sure that they're even, that folds are even. We're gonna look for stability, and this is when I would perform Barlow's and Ortolani's. And this is when you lift the hips up and out, and then back in. Really hard to do on that baby. Then I'm going to turn the baby over. Here we go. And I'm gonna just assess for any Mongolian spots, stork bites, make sure that there's symmetry. I'm going to assess and palpate the spine. I'm paying special attention to the sacral area. If there's a tuft of hair, we want to make note of that, and we want to make sure that a dimple is closed. If there is a sacral dimple, we know how deep it is. All right, we're going to look at the gluteal folds. They look symmetrical, and I'm going to use this time to listen to the baby's breath sounds on their back. Okay, I'm going to drop my steps. There we go. All right. Now we're gonna turn the baby back over, and we're gonna feel bones in each extremity. We're gonna check all of the joints for full range of motion. I'm gonna check the palmar grasp reflex. The baby's fingers should curl around. I'm going to check the plantar grasp. The baby's toes should curl around. And then I'm going to check the Babinski by making an upside down J and watching the toes fan out. All right, now we're gonna do the stepping grasp, and that is, or the stepping reflex. When we stand the baby up and put their foot down, they should be kind of making a stepping motion. And that looks good. Now we're gonna check for the Mora reflex or the startle reflex. And the way that you can do this is just by kind of dropping the bed, and the baby should put their arms out in the shape of a C. All right, our newborn assessment is finished. Let's get this baby wrapped up and brought back to mom. Thank you.